Often when a person is first coming out to a medical professional, it's actually, it's not the first time they thought about it. You know, this has been a really big deal, a really big issue getting to that point, working up to that point where they feel safe and comfortable coming out to a GP. And it's especially important that the person that they do come out to is receptive, is responsive, is validating, and is going to, you know, affirm them in their identity.
Just asking about pronouns or name, your name change and everything, I think it makes a huge difference and impact on, you know, how we feel about ourselves, because transitioning isn't easy, you know. It's kind of a journey. So, you know, people acknowledging that, you know, oh, well, you change your name and you're calling them by the correct pronouns, it can make a huge impact on you, definitely.
Write the letter with the correct gender and pronouns. That means if they tell you they identify as male or female or non-binary, if they say they identify as male, say this man or this gentleman, you know, is looking to transition to male, and make sure you get on that referral immediately, because there is an extremely long waiting list. And also be aware of the fact that they might need hormones sooner, because if they waited so long to tell you just that they need healthcare, that they've been waiting already a long time just to get to that point. And you can refer them to an endocrinologist directly if the GIC is going to be a very long time. People's lives are depending on this, on, you know, you're the first person they interact with. They need you to do your best to care about their experience. And ultimately, you know, this can affect their ability to survive.
In the past, you know, I was, you know, referred to the gender identity services, but I think the questions that, you know, some of these healthcare professionals ask, I think it comes across quite intrusive. I think they kind of define our gender, of course, you know, based on how we express ourselves, rather than us telling them that, you know, I mean, who knows our gender better than, us? So I think that should be enough. And, you know, the nails and the makeup and the jewelry and everything, I think that doesn't make me a woman. They're just preferences. So I think it's really important to, you know, if you have a patient, to really, you know, don't judge them on their exterior. You know, if they're telling you that, you know, they're dealing with these kinds of issues, I think you should just take them seriously and take their word for it.
I feel like the system kind of approaches us as like this special case of women who want to be made into men, or men who want to be made into women, or this idea that the definition of trans is about engaging in medical transition rather than being about who you are as a person. A person is who they are regardless of whether or not they transition. I consider myself to have been born male, despite the fact that I was assigned female at birth. I feel like, you know, approaching the medical profession has been like me being seen as a woman and having to prove that I'm really male.
I think one of the biggest issues is screenings, which cis people, non-trans people are invited for automatically. For a trans person, when they change record, they get knocked off that. And it's really important to remember that a trans woman needs to go for the screenings associated with a cis man. A trans man needs to go for these screenings associated with a cis woman. Just because someone's trans doesn't mean that they're not going to get cervical cancer, abdominal aortic aneurysm, or anything like that. So it's really, really important to make sure that these screenings still happen.
I have a heart condition, and I've seen the consultant over a good number of years, and I had to go for a check. I went for the hospital appointment. I checked in with the nurse, and she asked the name, Roberta Helen Hallam, gave her my full name, Ms. I sat in the waiting room, and the doctor's room door was open. I don't want to call it surgery, it was a room. And the doctor shouted, Mr. Hallam, Mr. Hallam. And I didn't move because I'm not a mister. And he did it a couple of times and I didn't move. And I'm the only person in the waiting room. And then he put his head round the door and he said, and I'm presenting like this. And he said, Mr. Hallam? I said, no, it's Ms. So I went into the office and he starts going through his records. And I said, I feel really quite bad about being misgendered. And he said, well, I'm just looking through your records and I've got these labels and this is your name. And I said, well, it was 22 years ago because the address, I haven't lived there for over 22 years. And you're using these old stick-on labels, you're using the old records, and it's not acceptable. And I feel that, you know, to have that when clearly I'd given my name to the nurse, I said, it's really hurtful. And he didn't say sorry, he didn't say, just said, all right, I'll get some more labels done.
A trans woman walking into a service with a bunch of men, which happens particularly at the AAA service, can be quite daunting and scary, and it immediately outs the person. So talk to the person, ask if you can tell the service that they are trans and they'll need either an early or a late appointment to avoid having to sit in waiting rooms full of other people. And simple things like that can make a huge difference to people getting screened or not getting screened, and in turn to people's life expectancies and life outcomes.
There's kind of like a common myth that being trans is a mental illness, or somehow mental illness or childhood trauma could cause somebody to identify as trans, and that's completely untrue. We're born this way, regardless of our life experiences. We will be who we are, and the fewer traumas that we have, the easier it will be to come out and live authentically. And if a person has had difficulty and trauma in terms of their living their authentic life, they're very at risk for mental health issues. So a person telling you that they have mental health issues should never put into question their identity, but rather telling you their identity should flag for you that they are at risk of needing additional support.
It used to be that maybe 10, 15 years ago, maybe a little bit more, that before someone could be referred to a gender clinic, they had to have full psychiatric screening. Fortunately, that's no longer the process, and a GP can refer now directly to the gender clinic. The referral form is on the website, which is easily found just by searching Leeds Gender Clinic on any search engine in the section for GPs. It's surprising how many times decisions are made about trans people with no involvement from the trans person. It's really, really simple. If you're going to do something that involves a trans person, as you would with any other patient, involve the person. It can be anything from deciding on a medication right up to a policy for the whole practice. If you know someone is trans and something's going to affect them, just ask what they think of it. It's a very small thing and it will make a big difference.
It's about having respect and having patience. And I think the patience and the listening are the big things that I expect. That doesn't always happen, but it does happen. But I think once you get somebody that will listen to what you're saying, you feel you're getting the help that you need.
There has been a GP in my surgery who's been just very, very good in terms of providing trans-appropriate care. And it's not because she has some kind of very specialized education. She's just listening to the experience. If she's not sure, she asks. But I did actually have a very positive experience talking to her, that I felt that my questions were taken seriously. I was given an appropriate referral to an endocrinologist rather than I don't understand this and I won't answer any questions about it sort of response. So she basically gave me the full measure of care that she would have had for a cis patient, but she was considerate of my additional needs as a trans patient. It was a very energizing experience to be taken seriously. I felt very much more in control of my health I felt taken seriously. I felt listened to. And that gave me a very positive feeling moving forward that, like, that my health was safer, that my outcome would be better, that, my GP was somebody I could rely on and could go to, and, not have to keep things to myself while the world crumbled around me, sort of thing. So knowing that your GP has your back and will support you and provide you with appropriate care is an extraordinarily empowering feeling.
All the information is out there. It takes very little time to educate yourselves. You're already busy, but that extra 10, 20 minutes of learning something can make the biggest difference to one of your patients' lives, and it could literally be the difference between life and death for that person.
We know who we are and we know what we want, but it's just there's so much gatekeeping. I think that's what it is. There's so many things that restrict us from accessing necessary healthcare that it shouldn't be like that. It really shouldn't.
The thing is that many health professionals do get it right. And when they get it right, it's a nice feeling. It's really, you feel, it kind of reinforces your identity. It's a really lovely feeling for them when they get it right.